Hello and good morning, everyone. Thank you all so much for joining today on our transplant patient panel. I think we're very excited here to be partnered with TRIO and Dr. Emily Blumberg to share some insights into how the transplant patient community is coping with this new world that we're living in with the COVID pandemic. I'm just here to kick us off with a couple of housekeeping items. I'm Sasha King, the Chief Marketing Officer here at CareDx. As you can see here at the bottom of your screen, we have a couple of ways we'd love to make this very interactive and engaging for all of you watching from home. One thing I see a lot is this idea of we're all separate but together. And this is really our opportunity to do that here with all of you. And one way we want to engage you all is through polling questions. You will see us put up polls throughout this talk to gauge how you are all handling things today with everything that's going on. We also have a great chat function. And in fact, I'd love to kick us off with a chat function. If you all see the chat button here at the very bottom of your screens and can click into that, you have an opportunity to chat out to all panelists and attendees. If you want to share with all of us one word, how are you feeling today? So everybody at home who's watching right now, if you can chat into the box, one word about how you're feeling today. We'd love to get a sense of how you're all doing. Amazing. I'm seeing some excellent posts, really and powerful to see. You know, we now have over 150 people joining us and sharing some very positive messages. And I also see some frustrated messages. You know, really, I think we see the gamut from people doing great and feeling good and feeling relaxed. I'm seeing Bruce and gratitude and at peace. So thank you all for sharing your feelings right now. But also I see a number of you feeling a little bit frustrated and nervous. And so these are all questions that we want to address here on this call. And I'm very excited to be the one to introduce first Mr. Jim Gleeson. So Jim is the president of the Transplant Recipient International Organization and our partner here at CareDx as we put on this event. TRIO is widely recognized as the leading voice in transplantation for transplant patients, representing not only the recipients, but donors, families, caregivers, candidates. Jim received his heart in 1994, so really an incredible person who's been so gracious in sharing his own transplant story with all of us here at CareDx, but I know with the entire transplant community. Married and has 3 children and 7 grandchildren living out in Beverly, New Jersey. I had the opportunity last year to spend some time with Jim out in Philadelphia, so it's really somebody who's been a great friend, and Jim, I'm so glad that we have you here to help us lead this panel discussion. And so without further ado, Jim, I'll pass over to you for a few words.
Thank you, Sasha, and especially thank you, Peter Mang, for partnering as you have for so many years with TRIO in supporting the transplant community, transplant recipients, families, transplant candidates, medical professionals, all part of the mission of TRIO to reach out, advocate for that, educate the public about the success of organ donation and transplantation, and to offer educational opportunities like this for our transplant community. I also want to say a special thank you to Penn Medicine's Dr. Emily Blumberg, who's taken the time today to give us this education. And also the TRIO team, our board members, who come with different type of organ transplant types, and from all over the country. And so thank you for those who are attending today. I hope you get out of it what we have to share from a very personal basis. And again, Peter, thank you. I'll turn it over to you.
Well, Jim, thank you so much for being the great person you are and providing this to us. At CareDx, we are providing different products and services to really for the transplant community, making sure that you have the peace of mind. And when I'm looking through the chat, it's so amazing to hear the various emotions that are currently on. And the emotion anxious, if there is something that we can help you with a peace of mind by having novel technology with advanced testing, providing measures of the health of the organ, but also the measure of the immune system with our solutions here at CareDx, that would be a huge contribution and something very meaningful to us here at CareDx. We also want to provide useful information. You as patients and clinicians need useful information. There's a lot of information out there, but we'll be hearing a lot about what is truly the useful information, keeping records and making a plan, and then what is truly important. And here we at CareDx, we have OrderCare, a medical records solution that provides plans and keeping record for transplant patients. And the last one, information is so important when it is needed, but it's very important is to be crystal clear when is the information needed. And clinicians can make better decisions when they get timely information, and then patients get understandable information by getting these results in a way that they can actually approach them and have access to them. And then you hear about Remote Track. Our Remote Track solution is really based on our long-term mission for, we are committed to improving patient lives at CareDx here. We focus on long-term patient outcomes. Here on this chart, you not only saw a recipient, but also a donor as well as a primary caregiver. So it's really the entire transplant village. We at CareDx, we come to work every day to service the transplant community. So really very strong focus on the transplant community with all what we're doing. We have launched Remote Track. Many of you here on the call are probably Remote Track patients. We have now almost 200 participants in this call. This is completely amazing. Within the last 6 to 7 weeks, we have launched Remote Track mobile phlebotomy service. More than 150 transplant centers have jumped in. More than 2,500 patients are already signed up of the transplant community. We're making sure that you get not only AlloMap and AlloSure, but also your routine blood draws and make that available through mobile phlebotomy. So a very new offering. We're really jumping in. We're learning as we go because we used to work with transplant centers, and now very often we work with transplant patients directly. So this is not only a transplant center by transplant center, but also patient by patient solution that we are now offering at CareDx. And Jim has been phenomenal as we were thinking through the launch of this product. So thank you very much for Trio and Jim for your support initially as we get that off the ground. One individual is completely amazing and probably wouldn't have been better suited through this crisis as the AST president. So Dr. Emily Bloomberg is the director of the Transplant Infectious Diseases Program at the University of Pennsylvania. She's also the current president of the American Society of Transplantation. Emily has authored or co-authored over 120 publications and is the associate editor of the American Journal of Transplantation and Transplant Infectious Diseases. Dr. Bloomberg is extremely passionate about transplant patient care. She's a leading source of knowledge for the entire transplant community, especially considering that we are in this unique situation with the pandemic around us. We have a true expert in our midst. And we are so appreciative to have her chair this panel on the impact of COVID-19 on the transplant community. Emily, over to you.
Thank you very much, Peter, and thanks very much to Trio and CareDx for hosting this. I wanted to just start by introducing a little bit about COVID-19. Sasha, can I get the first slide, please? Thanks very much. This has been an unprecedented time in American and worldwide medicine as we've been confronting the ever-changing landscape of this pandemic, COVID-19. I think from the transplant standpoint, what we're seeing is there's tremendous amounts of information and we get it in real time. The number of sources we get it from is extraordinary with a real diversity. You might be watching TV, going on web, reading in print media, any number of sources that you might hear that you're going to get the information. One of the things that's so difficult is trying to figure out what is a trusted source here. And this is really difficult because this is a rapidly changing information stream. And what's in one day is clearly out the next. So if I were talking to you 6 weeks ago, I might have been talking about one set of therapies that now we would say we've totally discounted. We don't use them anymore. We're just now starting to get more and more transplant specific information. And so it's becoming really complicated to try to understand what's real, what's not real, and where you can go for your own specific information that's really going to help you live your life to the best of your ability and in the safest possible way. Next slide, please. So I just want to go over with you some of the places where you can get reliable information. The first thing is I want to counsel you that you should really make sure that your information is fact-based. And because facts do keep changing, you shouldn't necessarily assume that what you learned 6 weeks ago is actually current information today. You should try to the best of your ability to make sure that the information you have is pertinent to transplant. And so sources that you might engage are the CDC, which is always very good and updated. We at AST have been updating our information, and both on our individual website and on the Power to Save website. UNOS also is a good source of information, as are local public health departments that may give you very important information that's relevant to your specific lives locally, as well as a number of webinars. We've hosted several on from the AST and from international transplant societies. TRIO, AAKP, and other transplant societies have done this. And it's especially important that you could remember to think about what your own transplant center is providing to you. I think you might have skipped a slide. Thank you. Now more than ever, it's especially important for you to communicate with your transplant center. Your specific questions, including medication management, what you might be doing specifically to protect yourself, how your center is handling telehealth versus in-person visits, lab draws. These are all things that are going to be very important to communicate with your specific center. In addition, if you have symptoms at any time, and be aware that the range of symptoms with this infection is quite broad. And in fact, as time has gone on, we've learned new symptoms that may in fact be representative. It's going to be very important that if you're concerned about your own specific health, that your first avenue of communication is with your transplant center, because they're going to be best able to determine how to evaluate you, what you should do next, any sort of changes in your management. And so it's really important to leave those streams of communication open. I know, having talked to many people at many different transplant centers throughout the United States and in Canada too, that every transplant center is focused on providing accurate information to their patients. We're all spending a lot of time updating the information and trying to provide information in real time. And that there's always this open dialogue with all of the transplant centers and our individual patients to make sure we're tailoring our recommendations to you as an individual, thinking about how to protect you, to keep you safe, to keep you healthy, and to manage any symptoms or concerns you have. So now more than ever, communication is really where we need to be. Thank you. So I think now we're very lucky. We have a great transplant recipient panel who's going to share with you sort of their journey and their concerns and how they've managed dealing with this unprecedented pandemic situation. So I'm going to let them introduce themselves, and we're going to start with Monet Thompson.
Hello, good morning out from the West Coast. I'm Monet Thompson. I live in San Jose, California, and I received a kidney from my brother Charles, my hero, 26 years ago in 1994, and have had excellent health since then. I've been a member of TRIO since Transplant Recipients International Organization since two years before the transplant, when I was on peritoneal dialysis. And I welcome everyone here today.
Thank you. And next up is Bill Solloway.
Good afternoon. My name is Bill Solloway, and I'm a board member for the Philadelphia chapter of Transplant's Recipient International Organization. Next month will be my 5-year anniversary since having my heart transplant there at the hospital University of Pennsylvania, and I'm really excited to be with you all today.
And next we have Elizabeth Rubin.
I'm Elizabeth Rubin. I'm from outside of Philadelphia, Pennsylvania. I've been a member of TRIO International and TRIO Board for many years. I am also on the board of both organizations and helped start the TRIO Philadelphia chapter. I had a liver transplant at the UPMC, now called Starzl Transplant Institute, on August 24th, 1992. The reason was cryptogenic cirrhosis, something that came on very suddenly. I'm very happy to be here today to share my expertise, if you can call it that, as a transplant recipient, and also to learn something about how I can deal with my feelings during this period of COVID-19. Thank you.
And next we have Stevo Connick.
Good morning, everyone. I'm Stevo Connick, and I'm a two-time liver transplant recipient for autoimmune hepatitis. My first transplant was on New Year's Day, 1993, and then I had another in 2001. I'm talking to you from Half Moon Bay, California, about 25 miles from San Francisco, and it was at UC San Francisco where both transplants were performed. I was the TRIO San Francisco Bay president for about 6-7 years, and also editor of our newsletter, and now I'm on TRIO's national board. The challenges I face today, I still have issues with my biliary tree, although it doesn't keep me from an active life. And surprisingly, my wife of nearly 40 years also has developed autoimmune liver disease. It's a pleasure to be here with you.
And finally, we have Chris Jones.
Good morning, good afternoon, wherever you are. My name is Chris Jones. I am from Syracuse, New York, where one day you are outside playing golf and the next day you're shoveling snow. I was a sufferer of hypertrophic cardiomyopathy and had a heart transplant in November of 2017, so I'm a heart transplant alumnus of University of Pennsylvania. I do this and I serve on the TRIO board in service to other transplantees, but in honor of my donor, Matthew. And thanks for having me with you today.
Well, thank you very much for your introductions. We're going to start with a question that's sort of a general question. I think we've all been impacted by COVID-19 pandemic in some way, and I'm wondering how it's been different for you than your friends or family members because you're a transplant patient. So we'll start with Bill. I think you're going to start us off on that.
Can you unmute yourself?
Can you hear me?
Perfect. We can hear you, Bill.
All right, great. So I've actually been telling my family and friends kind of welcome to my world. Ever since my transplant, I took my immunosuppression very seriously, being careful not to shake hands. Certainly when I traveled, I always wore a face mask. So this is really nothing new for me. The only difference really is the fact that if we have a breach in our system of using sanitizer on our hands and just being careful about germs, it's not like we're going to get the common cold anymore. We're going to get something that's more severe. So as an active individual who likes to bike and as an advocate for other transplant patients, I'm no longer able to accompany patients or see patients in the hospital setting. So I've had to learn to adapt, which we'll talk about a little bit later.
Elizabeth, what's changed for you?
Well, I would say that, like both who have spoken before me, I feel like I've returned to the world of transplant. I've been out a long time, and I've been healthy for most of that time. And many people to this day do not even know that I had a transplant, but I know I had a transplant. So I am taking the extra precautions I've been told to. And it gives me a certain amount of uneasiness, because I feel a little torn between the fact that I am now a healthy transplant recipient, whereas almost 28 years ago, I was not healthy, and it was much easier to take certain precautions that it seems to be now, because I want to be out there doing things, and I'm not sure exactly when it will be safe for me to go out and rejoin society and do the things I enjoy doing, like biking, swimming, socializing.
And Monet, how's it impacted you?
The main thing is I have a 98-year-old mother back in North Carolina, and she's doing great. But if something came up, it's dicey about flying, and I just wonder when that will change. In the grand scheme of things, I feel very fortunate, and that's the largest issue right now.
Thank you. So I think this brings us to a few other concerns here. I see that on the chat function, some of the people have written that they feel quite isolated from everyone, and I think that's probably something that's been accentuated during this time. So given these challenges, I wonder whether you all have tips for coping during this time. How do you handle things like your groceries, your medications? How are you staying active? What are you doing about interacting with the healthcare system? So I think, Chris, we'll turn this over to you.
Thanks, Dr. Blummer. Actually, I've tried to redefine the term social distancing and really focus on it as physical distancing, because I think it's really important that we maintain much more social contact. And there's lots of ways to do that. For some of the people who are on this call, I may be in a similar boat. I lost my job at the beginning of March. So that added a whole new dimension to the impacts of COVID. So you're not only dealing with this as a transplant, but you're also dealing with this as someone who's a sole income earner in their home, and really trying to find a job in this environment. It brings on a whole new set of stress. But in general, I think we're coping with it very well at our house. I think it's really important to develop and maintain your routine. So obviously none of this is routine. So you have to kind of create what that new routine really is for you. Physical activity is a must. The dog has never seen more walking in the last 90 days of her life than she has, in the 9 years that preceded it. I've taken to indoor exercise, even though the elliptical machine is too close to the ceiling of my basement. So I've had to take and wear headgear to make sure I can do that safely. But the other thing too is that this, for a lot of us, is an impact to the family. I have 2 college students, one that was living at home and one that was forced to come at home. And for them to understand that, our chain is only as strong as the weakest link. And so they're quarantining largely in respecting social distancing or physical distancing, mainly because of me. We've done all the things that a lot of people have done with a designated grocery shopper. So we're not sending everybody into potential vectors for infection. Mail order pharmacies, telemedicine. I've used 3 telemedicine appointments in the past 90 days for different things. So everything's working as well, I think, as it can under the circumstances. But focusing on the positive and staying on a routine are probably the biggest things to focus on.
Thanks. Bill, did you want to add some comments to that?
Yeah, thank you, Dr. Bloomberg. What I found is that structure is really important in getting through the day. I make sure that I have a routine of getting up at a set time every morning, making my bed, getting on my bike, which I'll talk about a little bit later virtually, and just have some routine where I get up, I get showered, I get dressed. I'm involved in a lot of other groups and organizations, so I find it important to reach out to them. If it's not on a phone call, maybe holding meetings through video conferencing, but still having that interpersonal communication, whether it be on the phone or through a video chat. I also have my meds delivered by mail, so I don't really have to worry about that. I have neighbors, again, enacting my support group at the time of transplant that check in on me. They text me and say, hey, I'm at the store. Is there anything I can pick up for you? And we practice precautions then. They drop things off. I make sure that I wipe everything down. So I utilize a network of my neighbors. Do a lot of shopping from home. I've tried all of these services that will actually shop for you through an app. I also keep an eye on my 91-year-old father who is in a nursing home. I had the foresight to set up a program called the Amazon Show, which is a video conferencing. So I'm able to talk to him 3-4 times a day, and that brings great peace of mind to both he and I through this period. Yeah, it's certainly a new world that we live in. It's a new normal, as we say in the transplant community, but you know, we're survivors and thrivers, so we learn to adapt pretty quickly.
Thank you. There are a lot of great suggestions that have come up here on the chat function, talking about taking online art classes, trying some things that are new, and really staying in contact from Zoom. But there's also quite a few questions here too. And I think some of the questions have to do with how do you stay safe? What if you really need to go out? You know, you need to go to the pharmacy, you need to go travel. Sometimes people have actually needed to get on airplanes to go places. And so what I would start with is assessing what is it that you really need to go out of your home or your local environment to do, and make sure that first, that it's a necessary activity and it's not just sort of something that, oh, you'd kind of want to do. But I think you should weigh the risks and benefits in general. We know that some general precautions are very valuable. We recommend covering your face, and it doesn't have to be a surgical mask or an N95 mask, but really facial covering. And we want the people in your, you know, when you go out, so the people who aren't your local household contacts who you're living with, to do facial covering too. And I think it's important to realize that facial covering really is protecting people who may be asymptomatically shedding from disseminating infection to other people. And that's the most important thing that we do with facial covering. We also want to make sure that you emphasize hand washing, and soap and water works well if you wash your hands for 20 minutes. But another option would be to use the waterless hand gels, but you really should be washing your hands frequently. You should avoid touching your face. If you need to get on an airplane, or if you need to take an Uber or Lyft or some sort of conveyance that is not your own public, you know, your own personal car, then you really need to be careful about is really upping the hand washing. I think if you're getting on a plane, you want to make sure that not only are you masked, but one of my colleagues just had to travel by plane to get married, actually. So that was great for her. But she said she got on the plane, and the minute people got on the plane, they took their masks off. So I think you should feel comfortable saying to people who are around you, please put your mask back on, because remember, the masks are to protect that people by preventing people from, you know, sharing the virus. So it's really an extra block. And then I would recommend bringing sort of, you know, some sort of antibacterial wipe and wiping down the high-touch surfaces that you might be in contact with on whatever this conveyance is that you're taking. And then hand wash, hand wash, hand wash. In terms of pharmacy contact, there's a lot of concern about whether or not your 30-day supply of medications can be extended to 90. And every pharmaceutical interaction should be addressed. So if your insurance is Medicare or whatever provider it is, you really want to make sure that there's no way that they will give you an allowance for a 90-day supply. And so I have asked specifically for my patients, for their medications, okay, for this medication, can you make it 90 days? And some insurers have now said that they're willing to go the 90-day route when they normally wouldn't, at least for this acute period of time. So don't just assume because you're routinely 30 days that there will be no allowance in your particular insurance. So it's absolutely worth asking about that. The other thing, and somebody brought this up in the chat box, is that for people who don't order their groceries online, but they have to actually go, there are special hours often for both people who are over 60 or over 65, but also there are special hours sometimes for people who have conditions that might put them at extra risk. And I would look at your local grocery store and see if you can do that. I would try to really plan ahead so that you're limiting your grocery trips to no more than once a week. And if you can go every other week, that would be even better. For people who live with people who are out in the world, maybe they're healthcare workers or they're essential frontline people, they should be really careful when they, with their own personal hygiene, when they come in the house, they should make sure they shed their clothes, shower, be very careful about high-touch surfaces that you share with them. If they know they have a known COVID exposure, they should probably go through a period of quarantine if that's at all possible, and, separate from the rest of the family for a period of 10 to 14 days if it's feasible within your setting. And I think what's most important is for each of you to discuss your own individual circumstances with your transplant center, because they may be able to help you brainstorm the difficulties of what might occur with your job or your family contacts or people in your lives who are, or the management of things like medications. So really use your transplant center as a resource. So we've made a lot of changes now in the way we practice medicine and the way we live our lives. And we have a polling question for you about what you would like to see continue in the future. So tell us, Sasha, did you want to do this? Tell us about yourself, or you wanted to just go straight to the next question? Okay. In terms of your health and medical care, what are things you would like to see continue? So telehealth, in-home lab services, availability of 90-day medication supply, increased awareness around what it means to be immunosuppressed, social distancing practices, and physical activity in the home. And you can select as many of these as you like. And I think that will be a good barometer. So we'll give you just another 15 seconds to answer that. And I think probably now you can display the results. So a lot of interest in telehealth and in-home lab services, 90-day supply, and increased awareness, and sort of middling level of the social distancing and physical activity in the home. So thank you. All right, we're going to go back to our panelists now. And I'm curious, has it been difficult for you to stay in touch with your medical care team during this time? And if your providers converted clinic visits to telemedicine, and if so, phone or video, what's your experience been? Steve, I think we're going to start with you.
Hi, everyone. Most of my work with my transplant center, because I've been doing very well lately, I haven't had that much interaction. But with my clinic, it's been a very different story. Over the years, I've tended to have a lot of skin cancers. And my transplant surgeon suggested that I should get looked at, say, at least 3 times a year. For that. And one of the things which is really giving me a lot of challenges right now is that my clinic has made a wholesale cancellations everywhere, and changed maybe about 20% of the scheduled appointments to video appointments. And most of these video appointments have worked out okay. But with my dermatologist, they've also been canceling them continuously. And so right now I'm looking at July until the first time this year I can get an appointment to have my skin looked at. I'd be very curious on other people's experience with this. First, because skin cancer is one of the most common cancers associated with immunosuppression. But I try to keep an eye on my skin every time I shower and come up with places I want to point out to my dermatologist. But invariably, those are the ones where she says, if they're big, she'll freeze them off. Otherwise, just ignore them. When she goes through me, she'll find things I never even thought about, never even noticed. And those are the ones which are the early squamous or basal cells. And thus, I'm pretty concerned about not having enough access to a dermatologist during these COVID times. I don't know whether this is the new normal after COVID, or it's going to be, if this is just during this particular time, but it's an item of concern for me. I'll put my email address in on the chats to see if anyone else has ideas or experiences on this.
Great, thank you. Monet?
Oh, one positive thing about the telehealth is that my health provider, you can schedule an appointment and download an app on your phone, and then you have the appointment precisely when you're scheduled to, and you don't have to wait in a waiting room or go out and expose yourself. But of course, I'm not sure that a lot of medical providers have that technology. I wanted to point out that you're not protecting other people when you wear the N95 masks that have the flap with the little plastic tab, because your exhalant just goes right out of the mask. So that's just a little tip. That's all.
Okay, thank you. Chris?
Really, from my perspective, I've been, very healthy post my transplant. So most of my doctor needs have been either, follow-ups with the transplant team or related physicians to care. As I mentioned earlier, I've used telemedicine. This is a plug, I guess, for University of Pennsylvania, and I'm sure many of us feel very positively and strongly about our transplant centers, but the use of the portal and the response times that we get from our physician teams and other folks through UPenn's portal is fantastic. They're very good about leaving detailed messaging if you tell them that they have the permission to do that on your voicemail should you not get a direct connect. So really, it hasn't been difficult. I had a nephrology appointment, which I canceled because I felt that a telemedicine appointment wasn't going to net that much more than what we would find out when I do my 6-month follow-up with University of Pennsylvania, which will, as I understand, be a remote appointment. But for me, living 4 hours away from the transplant center, I'm actually excited about being able to conduct the appointment that way.
Thanks. It's good to know that we're doing a good job here.
Fantastic. Big fan.
I will tell you, and interestingly enough, that there are certain visits that I think as providers we are especially concerned occur in person. And I can tell you that many centers are starting to revisit how to combine telehealth with in-person visits. And so we, among other people, have now put into place safeguards, and we are going to be reopening up for more in-person visits, but we have completely restructured our clinic to do that. And certainly we're going to keep telehealth visits, which is noted, are much easier to stay on time with. But one of the first groups that have gone in person in our center has been dermatology, for exactly the reason that you've discussed, which is that it's so difficult to do this by telehealth, and that a thorough skin check that we recommend be done, you know, usually in our center twice a year or more frequently if you've had some issues. We realized that needs to be in person. And I would urge everybody to talk to their transplant centers about things like either wound concerns, new skin lesions especially, or something else where they may have something that really needs to be seen in person, because my guess is your centers are all starting to address how to best do this, because I think as, you know, practitioners, we're all starting to learn some stuff goes well with telehealth, but there are certainly times when seeing somebody in person is going to make all the difference. And I bet most of your centers are really thinking hard how to do that. And I think we now have a polling question. Is that correct, Sasha? We have a polling question, or are we moving on to the other questions? I have two different. I think we're going to do a poll question here, which is, has it been difficult for you to stay in touch with your medical care during this time? So have any of your providers converted your clinic visits to telemedicine? And so think about that for the polling question, which is coming up next. I think, okay, we'll just give you a second to do that. And now we'll reveal the answers. And so it looks like 2/3 of you have been using telemedicine. And hopefully this number will, you know, whatever way you're doing to get your care, it's actually proven to be effective for you as an individual. So as transplant patients, sorry about that. Okay. So as transplant patients, how concerned are you about your health when it comes specifically to COVID-19? So not at all concerned, slightly concerned, somewhat concerned, moderately concerned, or extremely concerned. So how are you coping with this? So, okay, Sasha, I think we could show that result. So it looks like most people are really extremely concerned about this. And I think that you should feel like you're in good company, because most of the people I know who aren't transplant patients are much more concerned about their health now than I think they were before. There's certainly a heightened sense of this. So you're certainly in good company with that. So when we think about that, are there ways that we can reduce our stress and maintain mental health while observing social distancing? And I think, you know, our panel has some good recommendations of how they're handling this. So Elizabeth, I think we're going to start with you.
Hello, everyone. I am a big exercise fanatic. So I would say that has been a big plus for me. I make sure that I exercise probably 6 out of 7 days a week in some form or another. I am doing a lot of exercise videos, and some of the instructors I had at the gym I belong to have actually converted their classes to virtual, so that's helped. And I also make a point of leaving my house every day that the weather cooperates to go for a walk. I think getting fresh air for me makes a huge difference. I always wear my mask. I always avoid people or stay as far away from them as I can. And recently I've been able to start going back to playing golf. And I'm doing that walking. I am not riding in a cart with anyone. And I'm not even using a push cart to avoid touching anything that might not be clean. I also have learned that when I watch too much of the news, I get very anxious and upset. So I've stopped watching the news more than maybe once a day. And I've been doing a fair amount of reading, which I find very helpful. And then, of course, there's connecting virtually with family and friends. As has been mentioned before, I do a number of FaceTime video calls with people through some of the activities, the organizations I work with, but also with our daughters who both live in New York. We've done a lot of regular video calls. And I'm also doing dinners with friends from all over the country. I mean, just a couple months ago for Passover, we had a FaceTime call with 20 of our relatives and friends who were located all over the country, including Hawaii. So that has helped a lot. It's not the same as physically being together, but it is a big plus for my mental health.
Great. Thank you. Bill?
Yeah, so the bicycle really is my therapy and my stress relief. I always like to get on my bike and take it out on the pedals, as I say. And I live in the suburbs of Philadelphia in historic Bucks County, right off the Delaware River, and there is a canal trail that I love riding one of my bikes on. But certainly everybody has the same idea of getting out and exercising. And it wasn't before too long that that trail that I would love to bike on became very populated to the point where it was very difficult to avoid contact with people. And we're talking a canal trail, so a very narrow path with not much other place to go. And I learned early on, as soon as this trail got populated, to take my cycling indoors. So I ended up going on my trainer, which is hooked up to a program that allows me to ride virtually. In fact, this morning I was riding in London. As I was telling Peter earlier, I rode over Tower Bridge and certainly by Parliament and the London Eye. So it's really neat to see some of these sites. And I'm actually biking with friends, one of which is one of my nurses from HUP, ironically. And I've been biking in Central Park and in Innsbruck and in Richmond, Virginia. So it's the next best thing to being outdoors. But I agree with Elizabeth. It's very important to get outside and get fresh air, whether it's just walking around in your yard. I think we need to take advantage, certainly, of the nice days and, you know, get out and do some exercising.
Thank you. Steve?
Thanks. I'm amazed how Elizabeth was talking about watching too much news. And the first thing that came to mind when I was looking at this question was part of my social distancing is avoiding talk radio. And that seems to have helped reduce my stress a lot. Much like Chris had talked about, our dog has been a godsend. She's just so mellow, and I just enjoy being around her, taking her on walks and everything, getting outside. Our daughter, who is living with us, she's a college student, but because the college is basically shut down, she's doing all her classes online. She does the grocery shopping for us. I'll drive her over to the store, but she'll go in and take care of it. And that's another way of maintaining social distance. I do like to go to farmers markets, but I wear a mask, I stay 6 feet apart, and it seems like people are more in the farmer market I go to. It seems like people are more attuned to the mask and the 6 feet than at the normal grocery store.
Thank you. I think we have time for a few questions, and there's quite a few that have come out. And so I'm going to, even though the focus of this panel was really to sort of share things that are working or concerns that people have, you know, being transplant patients, I'm going to deal with a few of the medical questions here. The first is really people want to know, how is COVID in a transplant patient? What are the differences? How should it be managed? And I'm going to say that we are starting to learn more and more about this. And I think a month from now, I'll know more than I know today, which is pretty typical of everything with COVID. One of the things that we've learned is transplant patients are a lot like other people. The spectrum of infection is enormous. And I know some of the people on this chat have indicated that they've had COVID themselves. We've had everything from people having no symptoms whatsoever and being screened for reasons like they were coming in at our hospital. Before you can have a procedure or get treated for rejection, you need to be COVID tested so that we can have the right environment or make the right medical decisions. And we've had a few people who've been completely asymptomatic, who've actually had COVID and who then never go on to get sick and resolve their, their infection without ever having any issues. We've had some people who've had mild symptoms who have had any number of things from a little cough or a little achiness, fevers. We've had some people who've lost their sense of taste or smell. We've had some people who've had just really GI symptoms, and that's been the major thing. And then, of course, like every place else, we have seen people be critically ill in the hospital, or maybe not critically ill, but have enough symptoms that they've needed to come in. One of the things we've noticed is that there is a tendency in this to become unknowingly dehydrated, which I think is a bigger issue for transplant patients than for other people, because when a transplant patient becomes dehydrated, it has a direct impact on the drug levels of their tacrolimus or cyclosporin and potentially other medications they may be taking, and that can impact on their kidney function. And so it's really important that if you do get sick, that you maintain your hydration. And if you're having fevers, that doesn't mean drinking your usual amount of fluid. It means really increasing the amount of fluid you're getting a day to account for what we call insensible losses, those losses from sweating a lot or from having diarrhea. So we want to make sure that that's being replaced. And if you are having any symptoms whatsoever, you really need to discuss those with your transplant program so that you can be safe. We also are seeing something that we don't really know how to compare it to the regular, not regular, but to people without transplants or who aren't on immune suppression. And that is, it can take a long time to clear this virus. We don't actually know what that means. We know if we put a swab in your nose and check for virus, we may find that you're shedding for a long time. Now, we've seen this in people who aren't transplant patients too. And one of the things we don't know is, because of the way the test is done, it is possible that what we're seeing is picking up fragments of nucleic acid that don't actually reflect an active infection, but just kind of the dregs of what's left over. And it may not be clinically significant. But because of this, we are urging that people who have had transplants take a little extra precaution when they go out and around other people, and just increase the level of sort of hand washing and hand hygiene. The other thing that I would say is that there's been a lot of questions about whether or not people without symptoms should be tested either by testing, for the virus itself or doing antibody testing. And I want to let you know that today, May 15th, 2020, we do not know what to do with antibody testing. And anybody who tells you they know what to do is basing it on, I think, very limited experience. We know that some people are asymptomatic and have had infection, and that may be detected by antibody. But there are over 100 antibody platforms out in the community, and most of them, almost all of them, are not validated. And in fact, pretty much any test we do for COVID really is still undergoing scrutiny by the FDA to make sure we understand this. That's not to say that those tests we do to show active infection aren't valid and reasonable to do. It just means that we're sort of working so quickly in real time that we're still learning best practices in many of these cases. And this cannot be stated more definitively than for antibody testing, where we don't know. We also don't even know if transplant patients, especially transplant patients who are on certain medications, are going to make antibody and what the meaning of antibody is. So if people say, oh, I can just do these tests on you, be aware that they may be able to do them, but we may not know what to do with that information. And we may not be able to tell you what it means for you individually if you do make antibody, if you don't make antibody. And so just, be thoughtful about that. And really, I think the best thing to do is to understand the resources you have at hand. One other thing that I think is really, really critical is people ask a lot about what to do about their immune suppression. They're worried, maybe they've been exposed or maybe they're actually sick and they want to know what to do. The one thing I can guarantee you is you should not make this decision yourself. You must talk to your transplant provider. For each patient, for each individual, it's so important to look at all decision-making in the context of what your own particular medical experience and history has been. We may take patients who are sick in the hospital and adjust their immune suppression, but we're doing it in observed circumstances where we can watch what the impact of that is going to be. To do that by yourself in your own home could be quite dangerous. And the one thing we do not want to do is unknowingly cause rejection at a time when clearly access to care is a little bit different than it is in the past. So I hope that's answered some of the questions. I want to thank everybody for the panel, and I think we're going to turn it over to Sasha to conclude this session.
Well, Dr. Blumberg, thank you so much. I think, I just want to extend my appreciation out for all of your great insights and all of the knowledge that you're sharing with us, but also big thank you to our panel here, Monet, Bill, Elizabeth, Steve, and Chris. You all shared such great insights and helpful tips. And I also want to give, of course, a big shout to Jim Gleeson, but also to all of you who've joined us for this panel. I'll say that the chat has been extremely dynamic. We've really loved seeing all of your comments and questions and sharing, dancing and exercise. And I'm even seeing some connections from people who live in similar locations sharing local hiking tips. So what a great group. And thank you all for all your input and feedback. And with that, we'll continue to have these events. I'm also seeing some good feedback on, what you'd like to see in the future. So maybe just in closing, if you want to give one final word into the chat box to all panelists and attendees, how are you feeling at the end of this, and any closing remarks here? But again, thank you to everybody, and until next time, we'll talk soon.